Yes, this is Shafiq, a medical clinical officer and also an MBCHB student at Makerere University. So, our last episode of the Cerebral Malaria series is transition to oral medication and discharge. So, once our child is alert and can tolerate oral medication, we shall switch from IV medication to an oral course of oral ACT. But we always change when the child has at least received 3 doses of the IV attachment. In the event that the 3 doses are not enough to make this child tolerate oral treatment, we give a subsequent daily dose of IV attachment until when our child is stable enough to switch to oral medication. So once our child is stable enough to switch to oral medication, we start the orals and stop the IV. So we discharge on DP, dihydroartemisinin piperaquine, for all cases of severe malaria according to Uganda clinical guidelines. We discharge on dihydroartemisinin piperaquine. Those are the blue tablets. Fe muloko oba muloko community tugamba mpeyo ziri empeke eza blue. That's what they are termed. But in the event that you do not have those tablets, or you are in a very rural setting, or you're short on those tablets, you can discharge on artemether-lumefantrine. So you can also, before discharging this child, you can also recheck hemoglobin levels before you discharge the patient. Then you end with a follow-up plan where the child is reviewed monthly for 3 months. So you review this child every month for 3 months, and in those 3 months you provide monthly DP, dihydroartemisinin piperaquine, for post-severe malaria chemoprophylaxis for a period of 3 months. So when you treat a severe malaria, like cerebral malaria in our case scenario, in the discharge, you follow up for 3 months. But in those 3 months, you give DP every month for chemoprophylaxis or for prevention against this cerebral malaria. Then you counsel the mother on completing treatment and regular use of insecticide treated mosquito net, or you counsel on any other forms of preventing malaria in our home and also neighborhood. And that marks the end of cerebral malaria series. Thank you.